Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter K. I have finished the previous 3 videos regarding to the kidney and kidney diseases, and also other kind of diseases or abnormalities caused by the impaired function of kidney associated with the kidney's function of serve as an endocrine organ in addition to balance the electrolyte and the water. So today I think the other related topic came to me is Klebsiella infection, which is a bacterial infection caused by this bacteria named Klebsiella. I hope I say it right. But anyway, this is let me just bring up any emergency situation associated with this bacterial infection. I think there is. There's some actually. Usually this bacterial infection cause in those patients with lost consciousness, either by coma, neurological disease after stroke, or cannot swallow well, or the drink too much alcohol, cannot control themselves. So then during this deep sleeping time, the reflux from the digestive system come back, containing this Klebsiella bacteria, and then aspirate to the lung, cause the pneumonia. So that if that's the case, it could be quite serious, and it's not that easy to manage. So if that's the case, if you had a family had a post-stroke and also not swallow well, or suddenly develop this fever, coughing up the dark red maroon-like mucus, and then that's the case, you really need to call the physician or go to emergency room. Or if you had after Saturday or after Sunday, after Friday you had a good party and drink a little overdose of the alcohol, then a couple of days later you develop this kind of symptoms, fever, coughing with this special color of this mucus, then you really need to see a physician as soon as possible. So this is the urgent situation, and can you manage at home? I think this probably it's a good idea to get it checked, even though sometimes the diarrhea from this Klebsiella bacteria can be minor, but also can be serious. So still, if you have this diarrhea, then you need to check it, make sure it's not some serious complication coming along with it. So this is about the two ends of this emergency or manage at home. Let me just bring up the talk about this bacteria. We know in our digestive system we have plenty of bacteria. They are dwelling within us, and imbalance actually is the microecology environment. So they're happy and we're happy because of those normal flora actually make contributions to us. For example, vitamin K. So that's why the newborn, since doesn't have this established digestive system flora, so they have to receive the vitamin K. But for the normal adult, we have this bacteria. They can produce this vitamin K. So you already know vitamin K function as the anti-bleeding, so it can make the blood clot, so to stop bleeding. So which is really significant, plays significant role with us, for us to protect us. So that's the flora in our digestive system. So this Klebsiella is one of those. Like I said, in normal condition, it's not going to cause diseases like E. coli. We have it, but not everybody every day present symptoms like diarrhea or any other endotoxin caused severe diseases, because of this balance maintained by the healthy diet, healthy lifestyle, and exercise, drinking fluid, eating healthy, good habits from head to toe. So maintain the homeostasis, which is very important in terms of this concept. However, in those if these bacteria migrate to the other part of the organ, will cause diseases. For example, the E. coli or some other bacteria causing the blood will cause sepsis. And this sepsis, the bacteria circulating in the blood, lodge anywhere, will cause local focal infection like abscess or any other diseases, or in generalized cause the reaction from this sepsis, which is serious. So, like I said, if the digestive system or the content of the digestive system aspirate to the lung, for example, that's what happened to those aspiration pneumonia caused by Klebsiella. So usually occur with those, like I said, lost consciousness, coma people, or without intubation, or the after stroke, the swallowing function not very well recovered, lost the muscle weakness, so then the fluid coming up and they just aspirate to the lung. Or like I said, those happy life, too happy, probably during the weekend or Friday, suddenly drink over amount of alcohol and deep sleep, and then this content from digestive system back up, then aspirate to the lung. So these are the one of the infection, which is one of the most serious infection caused by this Klebsiella. So the symptoms I already said: fever, chills, and cough, and may or may not have chest pain. And the mucus is special color, dark red, kind of sputum. So if that's the case, you need to see your physician. Particular for those who have the other comorbidities, if you have this kind of symptoms, see an emergency or physician as soon as possible. And the other infection that can be caused by this Klebsiella is the urine tract infection, getting into the blood and circulating enlarge the urine system. And this bacteria has a special capacity has the urease to have the urease to break down the urea, become ammonium. This ammonium can attract calcium, so tend to form the stones. So on top of the infection, or sometimes not infection, but tend to increase the risk of the kidney stone. So if that's the case, so regardless, drinking fluid will do good anyway. And also if feel the pubic area pain associated the frequency, urination, and the fever without fever, and also the urine color may or may not change. So if that's the case, then I'll get it checked. In particular for female, actually, tend to have urine tract infection. And also if the flora in the digestive system was disturbed by eating different kind of food, and that also can have this Klebsiella cause diarrhea. Usually that's not quite serious, could be serious, but sometimes just kind of managed by some measurement, quite straightforward. So these are the infection caused by this Klebsiella bacteria, and you probably know it, or probably you do not know it. Just I think about this bacterial infection, so I present in this video. Hope that it can help you if you have those kind of diseases post-stroke or tend to drink. Then just pay attention to this kind of condition associated with this diseases. And for those who have systemic disease, in particular diabetes, if you have really need to pay attention, do not get this Klebsiella infection. That could be the consequences, complications could be worse than those without this systemic disease. So this is in terms of treatment. Of course, gram-negative rod has a special different kind of bacteria to target those. A different kind of antibiotics to target those gram-negative bacteria. Really depends on your physician's preferences and also your systemic condition or individually. So I'm going to stop here and hope it helps you, and thank you for watching. I will see you next time.